All right, I hope you enjoy our music. I had one guy in the last year or so who said, I'm annoyed by your music because I want to hear more about the science of it. But I think a lot of women out there are dancing with us. They're opening the Sunday morning with their coffee, and they're happy. And that's part of our life, and that's who I am. And so we're here with Dr. David Rivadeneira, Director of Colorectal from Huntington, who's going to be talking about now latest treatments for colon cancer. And I know when I was through training, we used to cut people open, take the whole part of the colon. The recovery was long. What's the latest? What's new in your field? What are we doing as far as technology when it comes to colon cancer?
So, Dr. Samadi, we've made tremendous strides in terms of the treatment of colon cancer. The listeners need to understand that this is an extremely curable process. So, if you are diagnosed with an early stage colon cancer, stage 1, stage 2, the survival rates, the chance of you living the rest of your life without battling cancer is extremely high, 85 to 99%. Those rates of survival drop down as the cancer becomes more later stage. But even with stage 3 colon cancer, when the cancer has gone to the lymph nodes, there's still excellent survival of 60% with chemotherapy.
And what's the first line of treatment?
The first line, no doubt, is still surgical resection. Removal of the tumor, along with all the lymph nodes in the surrounding area, is still the mainstay treatment. Chemotherapy is only given to those patients that have tumor that have spread to other areas of the body. So surgery is still the mainstay. And you mentioned, yes, when we trained many years ago, the treatment was done through a large incision, what we call a laparotomy. That is less and less often now. We do surgeries more minimally invasive, either laparoscopic or currently robotically many times. And this offers patients a tremendous benefit because the incisions are much, much smaller. Instead of a 2-foot incision, you're talking about 1-inch or 2-inch incisions usually.
So we're talking about robotic surgery for colon cancer. And obviously in my field, we do robotic surgery for prostate cancer. We look for those delicate nerves responsible for sexual function, for continence. I know you do a lot of robotic surgery for colon cancer. Explain to me, is there an incision? What does it take? How many days in the hospital so the audience understand what's going on?
So usually for the robotic approach for colon cancer or rectal cancer, there are several small incisions. So there are a couple of small incisions, usually one around the belly button area. That's where the camera goes in. And then we may have 2 or 3 small incisions for the actual robotic arms or the ports that assist us in doing the surgery, to detach the colon, to detach the blood vessels.
Less invasive.
Less invasive, less trauma tissue, tissue trauma, less bleeding. We definitely are able to visualize the nerves and the tissues much better with the robotic approach. It allows us access to different areas of the abdomen in the lower pelvic area for people with rectal cancer particularly, so we can see much better than through an open procedure and even better than a laparoscopic procedure. So the surgeries usually take on average anywhere from 1.5 hours to about 3 hours, depending on what type of procedure, how extensive. Body habitus of the patient is extremely important. We know that patients who are obese or super obese, these are more difficult procedures, so they take a little bit longer. Patients' average stay in the hospital is anywhere from 2 to 4 days, and the recovery, I think full recovery takes them about 2 weeks. This is a tremendous improvement, say, compared to open surgery, where they would stay at least a week in hospital, and true recovery would take about 8 to 12 weeks.
It's a huge difference.
Huge difference.
Look, we're talking about colon cancer, and you don't really need to die from this disease. He just talked about screening, the fact that you can get colonoscopy. Maybe it's not fun, but you do it once every 10 years after the age of 50, depending on family history?
Depending on family history and what is found on a colonoscopy. So if polyps are found, then they need to be repeated sooner, anywhere from 3 to 5 years.
There you go. So, and there are many different things that you can do. The colon sheds a lot of DNA cells that can find in simple tests. Give him a call. I know you work very closely with a lot of GI doctors. They do colonoscopy sometimes at the same time to find where the cancer is, and you can remove it with good outcome. That's amazing.
Absolutely. So, a collaborative environment, this is one of the important things about a health system as large as North Shore LIJ. We work well together with multiple specialties to bring the best outcome to patients. So, again, for your listeners, get yourself screened, get your loved ones screened. It's very important. March's colon cancer awareness, and spread the word around because it'll save truly thousands of lives.
Well, I appreciate you being here. And also during the commercial, I found that he's half Italian and half Spanish. So you got the Italian part. Now you're going to get the Spanish part.
Wonderful.
Thank you so much for being here. We're going to put this information online for you.